Hello, everyone, and welcome once again to the series of how to manage certain cases in pregnancy. So today our short case will be how to treat pneumonia in pregnancy. So let us start the case. How to treat certain patients like pneumonia in pregnancy. So today a pregnant lady presents to your OPD, or you are at the ward and you have been called for a consultation, and the patient presented with fever, cough that is productive, purulent sputum, and there is malaise. In physical examination, you found there is dullness to percussion, breath sounds are decreased. You can also find crackles, and there will be tachypnea, dyspnea. The patient can have certain other features also. Then you decided to do the labs. On the labs, you found to have a leukocytosis, CRP has been raised, and ESR has been also raised. Then on the X-ray findings, on the X-ray, if there is only lobar involvement, it means the opacity is in the one or more lobes. The presence of bronchograms will be there. If it is bronchopneumonia, there will be poorly defined patchy infiltrates scattered throughout the lungs. Or if there is atypical or interstitial pneumonia, there will be diffuse reticular opacities. But there will be absent consolidation. Consolidation will be in typical pneumonia. So the diagnosis of pneumonia is typically clinical. Means there will be clinical diagnosis based on the history, physical examination, laboratory findings, and chest X-ray findings. So our next step is, what is the diagnosis and how would you manage such patient? Because I told you that in the beginning of the series I will not go into further details, because this patient, we are going to treat this patient in OPD. We are not going to treat this patient in the ward now, because this is generally the mild presentation of pneumonia. So I will be teaching in another upcoming video how to manage pneumonia in wards in patient and which medication should be used. So here, whenever you're going to select certain medications for the pregnant lady, you need to think about, is the patient healthy, if the patient has any comorbidities, or if the patient has any risk factors for resistant pathogens. So if the patient is healthy without any comorbidities and she have no risk factors for resistant pathogens, so then the safest choices, one of them you can choose without any combination therapy, like capsule amoxicillin, tablet azithromycin, or capsule cefixime OD for 3 days. So mostly you have to treat the patient for 3 days, mostly 3 days, 5 days, or 7 days, depending on the severity, but mostly we treat the patient for 5 to 7 days. So this is the patient with healthy and without any comorbidities or risk factors. Let us see another patient, the same patient, if she presented with comorbidities and she have risk factors for resistant pathogen. Then how would you treat such patient? You will use a combination therapy. You will use combination therapy with this one. So in combination, you can either use amoxicillin and clavulanic acid 1 gram BID, or cefixime 5 mg BID with azithromycin 5 mg for 3 days. So you have to use a combination therapy if there is comorbidities and there's risk factor for resistant pathogens, and if there is no comorbidities and no risk factors for resistant pathogen, you can use a single agent. So for the supportive treatment, you need to manage the patient by giving fever. You can use the paracetamol, TDS 3 times a day. You can use anti-allergics like loratadine 10 mg OD. Adequate hydration, nutrition, and rest is important for the recovery of the patient. So as I told you, duration of treatment which is sufficient enough for therapy is mostly in 5 to 7 days. So this was a short case on how to treat pneumonia pneumonia in pregnancy. Please like and subscribe my channel. Hope you have learned something new, and it would make you confident in managing pneumonia in pregnancy. You can select the safest drugs in pregnancy for the treatment of pneumonia. Thank you.